Hi there, my name is John Knight. I am a physical therapist with Altius Physical Therapy and Wellness in Eagle and Avon, Colorado. This is the first video of a four-part lecture series titled Life Independent. And today we're going to be discussing functional resiliency. And then the next three videos will go over balance and falls, osteopenia and osteoporosis, and then finally arthritis and pain management. Okay, so stay tuned. All right, let's get into what we're actually talking about here, right? Let's define resiliency. Okay, so this is an individual's ability to withstand and recover from adverse events. Okay, so you have a fall, right? Can you get right back up? Or can you keep on with your life for the most part, maybe with a couple of bumps and bruises, but overall being able to withstand those adverse events? Compare that to frailty, which is a vulnerability to adverse events. Okay, so a frailer individual might encounter a fall, experience a fracture or some other injury, and be in and out of a hospital. So ultimately, that's what we're trying to prevent. Okay, and this is why we're talking about it in the first place, right? On average, as of 2021, we're living to about 77 years old. Okay, compare that to the 40s and the 60s. Um, the lifespan then was around like 64. You get to 1960s, now you're about 70 is the average lifespan. So we're living almost an additional decade as of 2021. And then as of the COVID pandemic, that's going to have a pretty significant impact on our lifespan. But from non-infectious diseases, our lifespan is really improving. Okay. And ultimately, as we get older, right, we're going to encounter more setbacks. Okay. So as this road continues, right, there are more roadbacks, more road bumps, more setbacks, things that we have to overcome. And unfortunately, this is not a flat road, right? This is an uphill battle as we age. Okay. So this is why it's so important. So let's get into why frailty occurs in the first place. Okay. This is the cycle of frailty. So this is why frailty develops. As I age, I encounter something called sarcopenia, which is a loss of muscle mass. So it's really taxing on my body to actually maintain muscle tissue. So that protein synthesis over and over again takes a lot of energy. So as we age, we lose some of our muscle mass. Okay. And what this results in is decreased strength and power output, decreased aerobic capacity as well. Aerobic capacity meaning your body's ability to transport oxygen to working muscle tissue and organs. Okay. But functionally, what that means is that my activity levels decrease. Okay. Same with my walking speed, right? It's harder for me to get in and out of the house, do whatever I want to do in the community because I've lost strength and I've lost power and aerobic capacity. Okay. And then what we see with that is because we're not expending so much energy, right? Our energy expenditure goes down. The amount of food and nutrition that we put in our body also decreases. Okay. So then we end up in this negative energy balance for some people. And this further contributes to muscle mass loss or sarcopenia. And so this cycle repeats over and over and over again, ultimately because of this decreased activity level. Okay. So what we try to do in physical therapy is intervene right here, right? We want to increase your strength and your power and your aerobic capacity so that you can increase your activity levels and then continue to fuel your body appropriately and prevent any future frailty, right? And we can intervene in all these different things, right? We can improve your activity level, your bone density, your aerobic capacity, balance, walking speed, and strength. Okay. But in order to stop this cycle of frailty from continuing over and over again, we need to work on strength and power and aerobic capacity development. Okay. So I think this is a really good slide that kind of depicts the difference between a frail and a resilient individual. Okay. On the top, you've got your resilient individual, and on the bottom, you've got your frail individual. This dotted line represents the threshold of dependency, right? If I'm below this dotted line, I'm dependent on somebody else for my care. And if I'm above it, I can do things my way and live independently, right? Ultimately, we want to create more resilient and independent individuals. If a resilient individual encounters some sort of setback, they can expect to have a little blip in their function, and then they recover usually back to where they started. Okay. Compare that to a more frail individual, right? If I experience a UTI or a urinary tract infection, I might be out for the count for a little bit, right? I might have to go to a hospital or some sort of rehab facility. And my recovery is going to be a lot longer too, right? Compare the duration of the recovery between the resilient and the frail individual. A frailer individual is going to take a lot longer to recover, and they might not even reach the level of function that they were at before. Compared that to the resilient individual, they're going to bounce right back to where they were before. So ultimately, we're trying to train you so that you are more resilient to these inevitable setbacks. Okay. This is a really, unfortunately, a depressing slide here. But for a frail individual, right, if they encounter one of these setbacks and they're now dependent, they're probably going to go to a rehab facility or a hospital or a nursing home or something like that. Okay. For a frailer individual or more frail individual, the rate of readmission to those facilities is higher. So even if you get discharged, the likelihood that you're going to end up right back where you started is higher if you're a more frail individual. Okay. The mortality rate is also increased. Okay. So your risk of death also increases with frailty. Okay. And like I showed here, right, this recovery is longer. So you can expect a longer hospital stay if you are a frailer individual. Okay. And we use a couple, there's a couple statistics that are correlated to your discharge location. So if you are in a hospital, a lot of this relates to your function. Okay. If you're an independent person prior to your hospital stay, you're likely going to be discharged home if it's not a serious injury. Okay. If you can get up and down from a chair really quick, you have good leg strength. So this is a timed up and go. That will usually indicate a better prognosis for discharge. Okay. And also having a better fall history helps as well. Okay. If you've fallen a lot in the last 6 months, the likelihood that you're going to get discharged home is probably less. You know, the hospital may send you instead to a skilled nursing facility or an inpatient rehab facility. And that's, nobody wants to go through that, right? So we want to keep you away from all these things, decrease your recovery time, improve your likelihood of being discharged home afterwards, and also reduce your mortality risk, right? Rocky said it best, right? Life is not about how hard of a hit you can take, or life's not about how hard of a hit you can give. It's about how many you can take and still keep moving forward, right? Okay, so let's break it down a little bit. We're going to talk about each of these 5 different topics here. So the first one, strength, power, balance, aerobic health, and then also community engagement. These 5 factors all play into resiliency as we age. Okay. So first, aerobic capacity. Okay. This is, again, like I said, this is our body's ability to transport oxygen to working tissue, right? So your muscles and your organs and all that stuff. Look at the 3 different lines here, right? On the top, this is your Michael Phelps. This is a really fit individual. He has a very high aerobic capacity, okay? As Michael Phelps ages, though, things are going to get harder, right? When he's 25, he can run 10 miles an hour, no problem. But by the time that Michael Phelps is 75 years old, he might have a hard time climbing up and down stairs, okay? But Michael Phelps is starting a lot higher than your average individual, right? This black line is your average level of fitness, and this line on the way on the bottom is your low level of fitness. Okay, so if I'm starting lower, I'm going to end up lower, and we can predict this rate of decline too. And this is why our aerobic capacity is so important. If I'm starting up here and I have a higher, or I'm sorry, if I'm starting up here and I have a high aerobic capacity, I won't have any trouble walking or climbing stairs by the time I'm 75. But if I'm starting all the way down here, by the time I'm 75, I'm going to have a really hard time getting up and down stairs. I'm probably not going to be able to walk up and down a steep hill confidently. And even walking is going to be a challenge. Okay. So this is why we need to train your aerobic capacity. If we can bump you up from, say you have a low level of fitness, bump you up at least up here, that gives you so much more independence and ability to do the things that you want to do in your day-to-day life, right? So these lines are not exclusive. Even if I have a low level of fitness with aerobic training, I can bump myself back up here and give myself a lot better prognosis for the next 10 years of my life. Okay. Now let's move on to strength a little bit. So this is a really cool study, pretty small, but they took 12 men, no women, unfortunately. Um, and the men were all aged about 60 to 72 years old. All of these participants had no prior experience with exercise or strength training, so they're all untrained, okay? And for 4 months, 3 times a week, they took them through a strength protocol, okay? And they measured the force output of their quads, so their big thigh muscles, and then also their hamstrings, the muscles in the back of your leg. And what they found after 4 months of training was that, I'm sorry, 3 months of training, was that their quads increased their strength by 107%. On top of that, their hamstring strength increased by 227%. Okay. So it doesn't matter where you're starting. It does not matter how old you are. We do strength and exercise training appropriately. We can make really significant improvements in the force output of your muscles. Okay. So I always get the excuse, I'm too old, or I don't know what I'm doing. I don't have any experience doing it, or strength training, right? And I kind of counter with this study, right? It doesn't matter what your background is. If you go through the right exercise training, right strength training, or you work with a good personal trainer or physical therapist, we can really significantly improve your strength output. Okay. This is a statement from the National Strength and Conditioning Association, right? Strength training is the most powerful intervention to combat strength loss, muscle mass loss, sarcopenia, that's what we talked about earlier, physiological vulnerability or frailty. Okay. This is a really powerful tool that we can use to improve your life ultimately. Let's talk about power. Okay. So power is my ability to move quickly through space, right? I think about getting up and down from a really low couch, like one of those ones that sinks, that you kind of sink into, right? Walking across the street, can I do that quickly? Can I pick up and lift my grandkid, right? Getting out of a low car or going up and down stairs, right? Let's all be like the Powderpuff Girls. Powerpuff Girls? Powerpuff Girls. So same kind of thing, right? They took this one, 9 participants, all 73 years old, roughly, okay? And for 3 months, 2 times a week, they did power training, right? Same thing happened. Significant improvements in their power output. One of the measurements that they used was the time up and go. So how quickly can you get up and down from your chair, do a little lap, come back down. They found a 15% improvement in that measurement. And then 30 seconds sit to stand. How many times can I get up and down from my chair in 30 seconds? They found a 12% improvement in that, okay? The cool thing about this study is the amount of comorbidities that all these participants had. Okay, so almost 90% had high blood pressure, about half had vision impairments, half had arthritis, and a third had fallen in the last 6 months. Okay, so this isn't, I would say, classify as like your healthy population, right? These are participants that have really significant medical things going on, right? Regardless of that, they still increased their power pretty significantly, right? And then this translates into what I just talked about, right? Being able to do these functional tasks that sometimes we take for granted, the things that require good power output, okay? So it does not, again, it doesn't matter what your background is in exercise training. We just got to get you started, okay? Let's talk about balance. So I like to break down balance into 3 different things. We've got our ears, we've got our eyes, and then my feet down on the floor. So my ears are going to are connected to my vestibular system, right? This tells me if my head is upright or if I'm turned to the side or if I'm rotated. It tells my body where I am in space, okay? Compare that to my eyes then, right? My eyes tell me information about my environment. And then my eyes also coordinate with my vestibular system as well, to give me a good sense of balance, right? And then my feet, okay, what am I feeling beneath me, right? Am I on a hard surface? Am I on a soft surface? Am I on a slippery surface, right? So that's my sensation from the ground. And all three of these work together to form my balance. Some other factors that contribute to my balance is strength. Okay. Do I have the ability to keep myself upright? Say if I trip over something, can I catch myself quickly? Um, Reaction time, and then also a history of brain injury. So unfortunately, I see this with football players or some sort of contact sports. Their balance is usually affected from repeated injuries to their head, right? Same with TBIs and stuff like that. Okay, so a history of brain injuries can also impact your balance. Again, though, if we work on balance training, we can make really significant improvements, right? This was a large study, so they took 601 participants, all 64 years of age or older, and they did 3 hour long balance classes once a month. Okay. Or after the year of doing this, they found a 40% reduction in your fall rate. Okay. So almost a 50% or cut that thing in half. If you're at risk of falls or you have balance problems, just working on that once a month for 3 hours improved their risk of falling by 40%. So it's a pretty dramatic improvement in their balance after that. Okay. And again, these are all individuals age 64 years of age or older. Okay. Again, does not matter how old you are or what your background and exercise is. We can still make really significant improvements. Okay. And then the last thing here is social engagement, right? Just being active in your community has a really impactful role in your resiliency. Okay. Um, Being active like in your senior center or church or getting involved in some sort of outdoor group, whatever it is and whatever suits you, um, has really important improvements or factors into my mental health, um, my cardiovascular health, my sleep, my quality of life. It reduces my risk of metabolic disease or diabetes and blood glucose related pathologies, and also can improve my fall risk and balance. Okay. And then this is the last one here that we'll talk about, right? Um, who doesn't love money, right? If I am a resilient individual, I can expect to spend significantly less on my healthcare expenses over the course of the year. Okay. If I'm independent and I can do all the things I want to on my own, no problem. If I'm 70 years old, I can expect to spend about $4,600 over the course of the year on healthcare related expenses. Okay. If I have one task, say like maybe putting my clothes on or something, or getting up and down the stairs, if I have difficulty in one activity, that translates to significantly more money that I'm spending each year on healthcare. Okay. Just one, this means activities of daily living. Just one ADL deficit translates to roughly $8,500 in healthcare related expenses at the end of the year. And note that this was in 2003, right? So this is not adjusted for the cost of inflation. And as we know now, right, this is going to be significantly higher in 2023 and 2024. If I have more than that and I have um, multiple deficits and some of the things that I like to do, like daily living tasks, right? I can expect to spend about $14,000. Okay. And not only that, my life expectancy is going to decrease. Okay. An independent 7-year-old can expect to live an additional 14 years on average. Okay. If I have one deficit on average, I can expect to live about 12 additional years and then lower that down to 11 if I have more than one deficit. Okay. So this is why I'm speaking to you in the first place. Okay. A lot of this comes down to how much you're willing to put into it. On the left is what Medicare will cover from a preventative perspective. Okay, so a lot of disease screenings, and these disease screenings are not meant to identify risk factors for diseases. They're meant to identify if the disease is already in progress, and that's where we fall short, right? A breast cancer screen or a mammogram is going to be positive if you already have some sort of cancerous tissue, right? Same with all these other cancer screens, bone mass measurement, right? If I go in and get a DEXA, it's only going to detect if I already have lost bone mass, right? It's not going to detect if I'm at risk for losing bone mass. Okay, so in my eyes, in my perspective, these screens are good, but they're already too late, right? If any of these are positive, I likely already have the disease. So instead, let's focus on preventing them, right? And this is what's missing, right? Medicare doesn't cover preventative exercise training, unfortunately, right? Which falls under all these things, right? It does not cover fall prevention, exercise group classes or anything like that. If you do have a significant fall risk and it's medically necessary, Medicare will cover it. Okay. But generally speaking, it does not cover fall prevention. It doesn't cover general strength training or aerobic conditioning or task training, or osteoporosis prevention. If you already have osteoporosis or diagnosed osteopenia, Medicare will cover exercise and physical therapy to address that. But in terms of preventing it in the first place, Medicare will not cover that. And then ultimately, it's up to you, right? If you want to prevent yourself from having any positive one of these screens, right, then we need to work at it beforehand. Okay, and then it comes back to this slide, right? Here is your resilient individual. Here is your more frail individual. This resilient individual has a hospital admission. They have a recovery. It's shorter than the frail individual, and they get back to roughly where they started, right? Compare this to the frail individual. They have a hospital admission. They go to rehab because they've crossed this level of dependency, and their recovery is a lot longer. Okay, and they might not even recover to the level that they were at before. So let's turn you into patient B instead of patient A, right? Just a shout out to our program here. So Altius Physical Therapy and Wellness offers a program called Thrive Forward, and this is our preventative program for a couple different things, right? We work on, in our classes, we work on mobility and balance. We work on muscle strength. We work on improving your bone mineral density, okay, so preventing osteoporosis. We work on dual task training, so keeping your mind sharp so that you can brush your teeth while you're walking or carry a conversation while you're doing 10 other things at the same time, right? And then also it's nice because this is a social opportunity, right? These classes usually range in size from about 4 to 5 people. And they take 1 hour. Okay, so just really quickly, what we do, we usually start out with some sort of mobility exercise. We do a warm up, and then we get into strength training, and then we do high intensity interval training. So this is a aerobic exercise format where you go hard for like 40, 30 seconds, and then you get a 20-second break, and then you work hard, and then you take another break. And that, what we found, has been the most beneficial form of exercise to increase aerobic capacity. So that's just a little spiel on that. I'll leave you with this too, because I'm a nerd. Bodies at rest will stay at rest, right? If you don't go out or you don't exercise, you can expect that 5-10 years later, right, that's going to come back and bite you in the butt. But if you're already exercising or you're an active person, it's way easier to stay active than it is to get started. But that's why we're here, is we're here to help you get started and address whatever you need to make that happen. Okay. You can also, if you like this content, you can follow me on Instagram. My tag is inertia_DPT. And here are the citations and references that I spoke about. So thank you so much for listening, and stay tuned for the next one. Take care.